Hi, I'm Dr. Loncast from Walnut Lake OBGYN and Wellness in West Bloomfield, Michigan. Today I'd like to talk to you about abnormal uterine bleeding. So in abnormal uterine bleeding, there are two groups of patients that we typically talk about. The first group is the patient with heavy periods. About 10 to 30% of women with heavy periods are between the ages of 35 and 49. The other group of patients that have abnormal uterine bleeding are the group of patients that have polyps and or fibroids. Now, nearly 55% of patients with abnormal uterine bleeding have this type of pathology. As you can see on the picture here, on the left are some polyps and on the right are some fibroids. Another group of patients that we concern ourselves with is the postmenopausal woman who has bleeding. Now, polyps and fibroids can also cause postmenopausal bleeding, but there is the potential for more serious conditions such as hyperplasia, which is precancerous cells, and malignancy, which is cancer of the uterus. So how do we diagnose what's causing this abnormal uterine bleeding? So there are a number of technologies that are available. First of all, good history and physical and some lab work will help us to see if this is something that's related to hormonal imbalances. But we also will include ultrasound of the uterus, something called saline infusion sonography, which is a saline infused ultrasound to get an indirect view of the uterus. And then the gold standard, which is hysteroscopy, a camera and a scope directly looking at the uterine cavity. So what is the importance of visualizing the inside of the cavity of the uterus? Well, blind biopsy alone could miss the diagnosis of one of these other findings or lesions. And a certain percentage of patients where blind biopsy is performed, the diagnosis will be missed. So how do we do this? Typically, we would take you to the operating room, give you a general anesthetic, have you fast the night before. Someone would drive you to the hospital, you'd miss a day of work, we'd put you to sleep, look inside, and then send you home. And of course, anything done in a hospital setting always has a higher cost. A new technology that we are using in our office is the Endosee office hysteroscopy. Now, this is a game changer for our office because it provides easy visualization of the uterus itself. Performed in an exam room of any type in our office. It's a point of care, meaning that we can do it right when you come in for your visit. It doesn't require any anesthetic, and it's very well tolerated by most patients. And then there's the cost. Endosee cost versus the operating room cost can be very significant. The loss of work for that day by going to an operating room, and the savings of about $1,500 per patient when it's not done in the operating room. Most patients after an Endosee are able to return to work the same day if they choose to. This is the actual Endosee camera, and this is a reusable camera with a port at the end here. And again, it's environmentally friendly because we're not throwing this piece away. We're actually sending away a plastic tip at the end after each use. We're able to take pictures directly while we're looking into the uterine cavity, and I can share those pictures with the patient after we complete the procedure by going back. And the nice thing is I can actually hook this camera up to my computer. I can upload the images and directly insert them into the patient's chart, so the images are there forever. So we have those images permanently. So it's a very nice device. It is reusable, completely reusable, and easy for us to use in the office. So after we're done with each procedure, we sterilize the device so that it's ready for the next patient. And every single cannula, we call that, the part that we put into the cavity, is disposable. It's a small, little, tiny catheter that inserts into the uterine cavity. So this is the Endosee device that we use in the office. So what has our experience been with Endosee? We've been very happy with the response of our patients and the results that we've gotten from doing Endosee. We're able to directly see the uterine cavity at the time the patient's in the office and immediately share those pictures and information with the patient and immediately make plans for whether a biopsy needs to be done or more extensive surgery needs to be done in an operating room setting. This definitely saves time and anxiety for the patient. So if you're having any abnormal uterine bleeding, no matter what your age, please contact your provider so that they can do a thorough assessment and implement a treatment plan. Please feel free to call our office at any time. You can find our number on our website, and have a great day.